For many people, leaving the hospital is only the beginning of recovery from an illness, an injury, or a surgery. To continue their return to their highest level, their physician may recommend they continue their recovery at a skilled nursing or rehab center. These centers combine medical care with physical, occupational, and other therapies in a healing and supportive environment. Today, we're joined by two people who can help us understand how short-term rehab contributes to someone's recovery after an injury, illness, or surgery. With us today are Lisa Holloway, Vice President of Health Services at Duncaster, and the Administrator at Caleb Hitchcock at Duncaster, and John Shulasky, a board member of Duncaster and founder of Elders Choice Connecticut. Welcome, John, and welcome, Lisa.
Thank you, Andrea.
So the first thing I want to talk about, Lisa, is to understand what it is that a short-term rehab center does. Tell us a little bit about that.
Sure. So years ago, short-term rehab centers were called convalescent homes or nursing homes. So those are old terms that really don't have a really good meaning connected to them. But right now, a short-term rehab facility is where somebody could go because of an injury or illness for short-term, have the rehab they need, and then go back home.
Okay. So those terms, and I think you're right, I think many of us know the term convalescent home. That's outdated. How so? What's the difference?
Well, because convalescent home, when you think of convalescent home, nursing home, you just think of this place where you go and then you just don't leave.
Okay.
And right now, short-term rehab is just that. It's short-term. You go, you recover, and then you transition home.
Okay. So what's the goal for someone when they go in for a short-term rehab?
Well, typically what will happen is a care plan is developed, which is a plan of care, and we work with the patient at that time and the family to determine how we can help them transition back to their home through, rehab services, whether it's physical therapy, occupational therapy, or speech therapy, and sometimes there may even be a need of respiratory therapy.
Okay, so someone gets out of the hospital for an illness or surgery. So why would they choose to do this?
Why? Well, typically it's typically a person their doctor would recommend short-term rehab. So you don't just go into the hospital and say, I want to go to short-term rehab. A lot of times the patients do have some say, but usually it's physician-driven, and it's also helped by the coordinators at the hospital that help transition somebody from an acute stay, which is typically, when you need a hospital setting, to a subacute, which is, less than you need less acute care, less hospital care, but you can't necessarily go home.
Okay, so John, you and I were talking earlier, and you made a good point about the fact that when you're leaving the hospital, you have choices.
Yes, and as Lisa said, if your physician or the transition coordinator says that you need to go to short-term rehabilitation, they should be giving you choice. It's very important for anybody to understand that you have choices. No one can say you need to go to this facility because we want you to be there. You have a choice to make, and those choices are entirely yours.
Okay. So what kinds of conditions would someone have that would say go to a short-term rehab?
Well, it seems to change every day with the Medicare rules, but I think what's important to understand that usually it's something that's unanticipated. It's a fall.
Okay.
It's someone has had a stroke or a heart attack. They may have pneumonia. Those are the things that are going to send someone to a hospital and then to a rehabilitation facility short term. But there are other things as well. It could be a planned surgery where they need to be in a short-term rehabilitation to get their strength up and to learn new techniques and get therapies. And that's a planned admission, and that can be done with a little more care.
And so how, if you had that opportunity and you did know, say, I'm going to have a knee replacement, and you're shopping for a short-term rehab center, what should they be looking for? What should you do?
Well, obviously, quality is number one.
Right.
And because you have choices, you want to be looking at places that have quality. And because the great majority of people who are looking for short-term rehab are older, you want to have clinical care, doctors and nurses and aides who are trained in geriatrics, who know about the differences. You wouldn't have a pediatrician, a child's doctor, take care of someone who's very old.
Right.
And frankly, you want someone who's very old to be trained, to be cared for by someone who's trained. And it's different. Then you want to be sure that you have some privacy. You want to have a suite that is a private suite. You want to have a bathroom and a shower in your own room. You want to have some room for people to come visit. And you want to have a track record of professional experience.
So are you talking about actually shopping, touring the facility?
Absolutely. There's lots of information. The Centers for Medicare and Medicaid have information right online for you to see what the ratings are of facilities. That's one way to do it. But stop in. Go take a visit. If you know you're going to need help, go visit. You have choices. And I would add one more thing, Andrea. I tend to believe that organizations that are mission-driven, not-for-profit organizations, tend to be a little more desirable than those that are purely out for the bottom line.
Okay.
Every organization is interested in quality care, but those that have a mission, that it's not for profit, those organizations seem to make a difference.
So I know you've had people that have actually toured Duncaster. What else can I do if I'm looking around?
What else could you do? So if you are looking for a short-term rehab facility, you can ask questions, talk to the admissions director and ask about their staffing ratios. And
Their
really,
staffing ratios?
Yes.
Which is?
How many CNAs per patient, how many nurses per patient, because that's pretty important. We know a lot of times when patients come in need of short-term rehab, they may have issues with walking. They won't be able to really walk by themselves, so they're going to need assistance. And so you want to make sure that you know that there's going to be enough staff available to help you as you're transitioning in your rehab stay.
So John, you talked a little bit about this, but talk a little bit about the kind of therapies that are available at a short-term rehab center.
Well, the better short-term rehab facilities are going to have a full complement of therapies. That's physical therapy, occupational therapy, speech therapy, which is not just about how you speak, but it's things like swallowing. So people who have had a stroke may have trouble swallowing, and that's training them to get therapies to understand to get better. Respiratory, pulmonary therapies for breathing treatments. They're a whole range of therapies now, and it's a very interesting profession.
Did we miss anything? Did we miss anything in the therapy department?
No, that's typically what happens. I do want to say that we have something a little bit special where we also have aquatherapy that is provided to our residents if they're in need of it. So, you really want to find a place that really is open to different types of therapies that aid in the recovery of whatever illness or injury you may have.
So, John touched on this a little bit, but how do these facilities vary?
Well, they vary in different ways. So star rating, they vary. John talked about the CMS website, so it's nursinghomecompare.gov.
Okay.
Someone could go on and look at the star rating. They also vary in their staffing levels and how they, how many RNs they have per patient and how many CNAs. So that's something that's different. My community is different because we have most nursing homes or skilled nursing facilities have semi-private rooms. We are all private suites. We call them suites because we have individual bathing areas, and so your room is really self-contained, almost like a hotel room.
Really?
Yes.
Mm-hmm. So how long could someone expect to stay in a short-term facility?
It really depends on the condition. It depends. So if somebody is having a planned surgery, say a planned hip, and they're in need of short-term rehab, they could be there maybe 7 to 14 days. If it's an unplanned stroke, they could be there longer.
Okay.
So it really is an individualized treatment plan that is developed for the person.
And so afterwards, what happens?
Typically, when somebody has reached their potential in skilled nursing and the goal is to go home, then we help them transition home, whether home is an actual house or whether home is a assisted living facility, wherever they want to go. Again, going back to John and talking about choice, we help them transition to their level wherever they need or where they want to be.
And I think you and I had talked about the fact that there's also, some people come back for therapy. They go home, but they come back.
Sometimes people, what'll happen, we can transition to home care, which has therapy. Then they can come back to our community for short-term, for outpatient therapy, which definitely is a plus because the therapists, know the patient from the internal stay.
Yeah.
They transition home and then they can come back for outpatient, and that does happen.
So in your experience, what are the biggest myths about short-term rehab facilities?
Oh yeah, so the convalescent homes, they want to keep everyone there. They don't help you transition back home. They provide too many medications to their patients.
Those are all myths.
Those are all myths,
Yep.
yes, because we are a heavily regulated industry, and our goal is always to help patients transition to wherever they want to go, whether it's assisted living or back to their individual homes. We are looked at from CMS and the Department of Public Health. Medication reviews are done on all of our records. Typically, it could happen when we have our state survey and review. So again, a myth that we, use lots of medications to sedate people or to change behaviors is just certainly not true.
Any that we missed, John?
I don't think so. I think it's really important that folks understand that they do have choices and that care is really designed to get somebody home as well as they could possibly be and transition to a good life at home. No organization wants to keep somebody in a rehabilitation facility. Their goal is to get them home healthy and ready to resume the best life they can possibly have.
So I'd like to end with getting some advice from each of you about making this choice, if you have the ability to sort of shop.
So if I were shopping for a skilled nursing facility, I would do the things that I said. I would definitely go onto Nursing Home Compare, take a look. I'd go to the facility and take a look as well, because you get a sense of feeling of each community, each skilled nursing facility. Take a look at the accommodations, talk to the staff, even as you're touring on the floor. Just see if people are smiling and generally happy, because that's pretty important. You want to have happy people taking care of you and being involved in your care. And don't go by yourself. Take a family member with you. So each of you could be looking for different things if that's if a possibility. So definitely your feeling about a place definitely helps, but there is data and information on the internet that can help you as well.
Okay, John, anything else?
I think don't necessarily schedule the visit. Show up. And it's, as Lisa said, it's how it looks, it's how it smells, how it feels. You're going to be there for a short period of time. You want to feel good about it. And if you look for quality, and as Lisa suggested, patient-centered people who really value the people, each one as an individual, get them home with a smile on their face and feeling better, that's what you want.
Okay, so get yourself home. That's the goal.
That's the goal.
Excellent. Well, I want to thank both of you for helping us learn about short-term rehab. Thank you, Lisa, and thank you, John. I appreciate the time and the information. We hope you've enjoyed this segment of Health for All for Duncaster. And if you have any questions about the topics that you've covered today, please get in touch with Lisa Holloway at Caleb Hitchcock at Duncaster. And join us next month when we'll explore the delicate question of when it's time for someone you love to move to a nursing home. Thanks for joining us. We look forward to seeing you again next month at Health for All from Duncaster.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.